Hi everyone, Dr. Remy from Pain Free and Fit. Today, whether you have degenerative discs, herniated discs, bulging discs, sacroiliac problems, facet joint problems, spondylolisthesis, or scoliosis, this is a great exercise for your lower back that you can do while walking to help recruit and learn how to use your glute max or buttock muscle correctly, sparing the lower back from stress. Hope you enjoy. The buttock or glute max muscle is involved in many cases of lower back pain. From patients that I treat with disc problems such as herniation, bulges, even stenosis, disc degeneration, facet syndrome, sacroiliac problems, and spondylolisthesis, a weak buttock muscle is integral to hip and low back mechanics, and having a weak or dysfunctional hip places abnormal stress on the lower back. Today's lesson is going to be talking about how to use your buttock muscle to stabilize the hip. Although the glute max or buttock helps us with hip extension and helps to stabilize through its attachment to the ITB, our lateral motions, so we don't tilt laterally or have excessive extension stress in the lower back via the lower back muscles, the buttock muscle very importantly helps to stabilize the hip so the hip bone doesn't glide forward in the hip socket, which is many times a problem with chronic lower back pain. It's called an anterior femoral glide or an anterior hip malposition. Now, you can check to see if this is one of your complicating mechanical factors by simply feeling the side of your hips at its widest point. You're going to feel a bone on both sides that protrudes. That bone is about the size of a golf ball. You can split your fingers so that you're feeling the front of that golf ball-like hard bone and the back side. And typically, if we just stand and raise one heel, allowing the forefoot to remain down, but just raising the heel, you're going to feel an equal pressure between both of those fingers. And in a person with an anterior hip glide problem, you're going to feel more pressure going into your forward finger as you raise your heel because the glute max or buttock muscle is not pulling backwards on the femur or the thigh bone and helping to stabilize it in the hip. You're going to say, well, how does that affect my lower back? Well, very importantly, when that thigh bone slides forward and you have a weak glute max, it sets up a typical pattern that aggravates disc, sacroiliac, spondylolisthesis problems because the hip flexors, particularly the tensor fasciae lata, rectus femoris, they become too strong or too active. And when they become too active, they actually tilt the pelvis forward. They cause an anterior pelvic tilt where the pubic bone goes down and the tailbone comes up. This increases the arch of the back, compresses the back of the discs, the facet joints, aggravating stenosis, disc problems, spondylolisthesis, even scoliosis pain. It also sets up a perpetual problem where when you use your buttock to walk or to stand up from a seated position, the buttock undercontracts because the hip flexors are so tight they enhance the weakness or the inhibition of the buttock muscle, and it causes the lower back or rectus spinae muscles to fire too much. That also compresses and aggravates back problems. So, if you found that the hip does glide forward into your front finger, you want to correct that by generating a backwards force with that hard ball, called the greater trochanter, into your rear finger. So again, feel the widest part of your hips. There's going to be a bone on both sides, about the size of a golf ball. Split your fingers and start pushing backwards with that bone. Sometimes you can use the buttock tension, but you don't always need to do that to create this correction. But a backwards tension into your back finger and away from your forward finger as you slightly elevate your heel. Again, I'm only elevating my heel maybe a quarter, half inch to get that motion down, not a big motion. And the more you do that, the more that you're going to practice and feel the correction happening, that bone moves backwards into your back finger away from your front finger. Once you have this down, you can then use that as you walk. As you take a step, you should initiate the forward step with that backwards tension every time you step forward. You can use this right and left. Sometimes the problem is just on one side, sometimes it's on both sides. If it's on both sides, I'd make sure I use that correction with both steps, walking slowly and thinking about generating a backwards force to initiate the heel raise and to follow through with that backwards force all the way until the foot hits and my hip is on top of that leg. Once I have that, I can focus on the other side and moving the hip in the same way. Very important while you're doing this, not to move the entire pelvis backwards. You don't want to swing your whole pelvis backwards as you're trying to generate that force. In fact, once you get this down with your pelvis in neutral, you can then utilize that in the normal walking mechanics of having your pelvis rotate forward on that side while the hip bone travels back in the socket on that side. And that's going to help to improve your walking mechanics, decrease stress on your lower back, and improve lower back symptoms. If you like this video on walking and hip mechanics for lower back pain, feel free to subscribe to our channel. We've got a lot of great videos out there. Questions or comments, write in. As always, I'll do my best to answer them. Give me a thumbs up to help me share this valuable information with others. And if you're looking for a great way to include walking mechanics and rehab exercises for your low back pain without taking extra time or going to a rehab therapist or rehab sessions that are separate, include corrections with walking, which we do all day long anyway, check out our Walk-Away Back Pain program available at painfreeandfit.com. It has a complete body analysis on your mechanics of your lower back. It has corrective exercises done while walking, corrective stretches, coordination exercises, and for those of you who even want to put a few more exercises in after your walks, it has supportive exercises. I hope this video on back pain and hip mechanics using the glute max muscle to stabilize the hip helps you with your chronic lower back pain.